Infectious bronchitis, a highly infectious and contagious respiratory disease of chicks, affects the oviduct, and some strains have a tendency for the kidneys. Disease can occur at any stage, but young chicks, especially under 6 weeks of age, are more susceptible. Great economic importance due to its adverse effect on egg production and egg quality in layers and on production in broilers. Other pathogens such as Mycoplasma or E.coli increases the severity and duration of the disease. Let's look at some of the causes of bronchitis. The virus belongs to a corona group of virus. Virus is fragile in nature and gets destroyed by common physical and chemical agents. Infection is by inhalation of droplets through ingestion of feed and water contaminated with virus and by contact with infected birds, contaminated movable equipment, clothing, and personnel. Virus is present in respiratory discharges, feces, eggshells of infected birds. This virus survives well outside the body during winter, therefore disease incidence and spread is more during winter than other seasons. Though disease can occur in any season, this disease spreads very rapidly in the flock, bird to bird by direct transmission through eggs. Fomites also can transmit the disease. What are some of the symptoms that you will observe? 1. In young chicks up to 6 weeks of age, respiratory signs like sneezing, coughing, gasping, tracheal rales, lung cremation, and nasal discharge are more common. The chicks will huddle under the hoover. There may be swelling of sinuses and face. In chicks, mortality may be as high as 25% to 60%, and the course of disease is 1 to 2 weeks. Respiratory noises can be heard more distinctly during night when chicks are normally quiet. In growers and adult birds, signs of less intensity are seen with less occurrence of nasal discharge and mortality is negligible. In laying birds, egg production declines 5 to 50% rapidly. Damage to functional oviducts in adults is very common. Egg abnormalities, production of misshapen, thin or soft-shelled, rough, smaller corrugations, and leathery eggs. The egg quality is poor with thin or watery white albumin. In uremic form, birds exhibit depression, ruffled feathers, wet droppings, increased water intake, and increased mortality of 0.5 to 1% per week due to ornithiosis, that is kidney stones. So when it comes to the gross lesions, serous, ketahol or caseous exudates in the trachea and bronchi lumen, generally without hemorrhages. Plugs of yellow caseous material obstructing the bronchi and lower parts of the trachea of chicks that dies. Fluid yolk material may be found in the abdominal ovary having the misshapen follicles. Middle third of the oviduct may appear atrophied and over-ruptured into abdominal cavity. Swollen pale kidneys and deposits of ureters in kidney, ureters, and throughout the body. Those are some of the symptoms you will see of the lesion. Now, how do you prevent and control bronchitis? 1. Strictly hygienic management procedures and vaccination can prevent the disease. So make sure you exercise hygiene and vaccinate your poultry. There is a chart for vaccination where you buy your poultry, you receive a chart, and that chart will show you when you should be vaccinating. It will be showing you at what age. When between days 5 to 7 days, you vaccinate. 28 to 30, you vaccinate again. So follow the vaccination chart and vaccinate your poultry to avoid bronchitis.